Hey, my name is Logan Robinson. I'm a 4th semester nursing student at MCC, and I'm here today to teach y'all about hand hygiene and the prevention of hospital-acquired infections, also known as mosquito infections. I'm going to let y'all take a little pre-test. I'm just going to give y'all a piece of paper and ask y'all a few questions, and then we'll go over them at the end. So can y'all list 2 examples of a hospital-acquired infection? I'm going to give you the definition of a hospital-acquired infection. It is something that is secondary to what they are admitted with. So if they come in for surgery and they are in the bed or whatever, they can develop an infection of some type, or if they have like a Foley catheter, they can develop an infection for prolonged Foley catheter insertion. Just things like that that might help you get an answer. What would be a reason to wash your hands? Obviously, you're going to wash your hands before each contact with the patient, but what are some items that you would need the facility to provide for you to have adequate hand washing? Okay, y'all ready? Hospital-acquired infections are common, but they need to be prevented as much as possible. Some examples of hospital-acquired infections are a urinary tract infection from prolonged use of a Foley catheter, pneumonia from becoming immobile or whatever. If they had a fall and they can't get out of bed, or they had surgery and they can't get out of bed, they're being immobile and they're just building up all that infection in their lungs. They give incentives spirometers to help prevent pneumonia, but also you just need to make sure that you have proper hand washing so you don't spread it from patient to patient to patient. Another one is surgical site infection and bed sores. So a bed sore isn't technically an infection, but it can lead to staph or other types of infections like that. MRSA, which is staph. The priority and easiest way to prevent infections in the hospital is proper hand hygiene. Be sure you take adequate time between patients to appropriately wash your hands, whether it be with soap and water or antibacterial or alcohol solution hand foam provided by the facility. I can't even read my own handwriting. Research shows that hospital-acquired infections are associated with 90,000 preventable deaths a year. You as a nurse needs to be sure that you are taking all measures to prevent infection and the spread of them. But also you need to be familiar with teaching patient and the patient family the importance of hand washing. One cause hand hygiene may not be performed appropriately may be due to the lack of accessible equipment for hand hygiene to be effective by the facility. The facility needs to stay stocked with running water, obviously, soap, and antiseptic hand soap, disposable hand towels, and usually facilities have the things on the wall with the alcohol-based hand foam. So whenever you first start washing your hands, you're going to inspect the surface of your hands for any breaks or cracks in the skin or the cuticles. Cover any skin lesions with a dressing before providing care. If lesions are too large to cover, you may be restricted from direct patient care because of the open cuts or wounds can harbor high concentrations of microorganisms. Number 2, you're going to inspect your hands for visible soiling. If hands are visibly soiled, you will use warm water and soap until the soil is removed completely. Number 3, inspect condition of your nails and try to prevent having any extenders or nail polish because they harbor bacteria also. And if you do have fingernail polish, be sure it's not chipped or anything like that. Number before, you're gonna make sure you push your sleeves and your watches up and remove your jewelry. This provides complete access to the fingers, hands, and wrists. Number 5 is antiseptic hand rub. You're going to follow the manufacturer's directions. Apply ample amount of product to the palm of the hand. I'm going to show y'all with this. Germex. So you're going to do like a quarter size. I didn't remove my rings, but I should have. So good amount. And you're going to rub your hands together until they're completely dry. So it's usually 15 to 30 seconds, and if it dries in less than 10 seconds, you want to add more solution. And don't wave your hands around trying to dry them, don't blow on them or anything like that. Just rub them until they're dry. Make sure you get in between your fingers and all that good stuff. Okay. If you're washing with antiseptic soap, you're going to stand in front of the sink, keeping hands in uniform away from the sink surface. You're going to turn on the water. I'm just going to demonstrate to y'all without a real sink. You're going to turn on the water with your hands, wet your hands, apply the ample amount of soap that you need. You're going to rub it together and lather up really good. Make sure you rub, rub, rub. You're going to take each individual finger and rub, go through your wrist. Make sure you get your wrist real good. You're going to, if you have long fingernails like me, you're going to use your other fingernails and get up under them, or some places provide a little plastic pick that you can get up under there with. Then you're going to rinse your hands. Be sure that your hands do not touch the inside of your sink, or you have to start completely over. And then whenever you get done, you're going to dry your hands with a paper towel from your fingertips to your wrist. Because if you go from your wrist to your fingertips, you're going to bring back all that bacteria back onto your clean hands. Turning off the sink. You're going to throw away your dirty towel, take another plain paper towel, turn off your sink, and then dispose of that. Be sure you use plenty of friction for at least 15 seconds while hand washing. And then you have different methods of hand washing. It's on my slideshow, but I haven't even really gone through that. So when you're choosing a method, you have 3 different types. You have minimal, moderate, and a surgical scrub. Minimal is just routine hand care. You wash with a non-aseptic soap. Quick hygienic hand disinfection, which is the alcohol solution or the foam that they provide on the walls outside the patient's room for you. Moderate is antiseptic hand washing. It's hygienic hand washing following manufacturer's instructions, and it's for 1 full minute. And the surgical scrub is for surgical care if you're going into a surgery room or a pre-op room or the OR in itself. You're going to wash from your fingertips to your elbows for 3 full minutes. And the same thing, you're going to dry from your fingertips to your elbows and all that stuff. I think I went through all this. Statistics show that 90,000 preventable deaths occur annually due to hospital-acquired infections. You're going to use proper hand washing, use gloves appropriately, and then of course when are you going to perform these tasks? Like you're going to make sure that you know what the patient's immune status is and what infection they're carrying and all those other things to determine which hand washing method you use. I went through these: minimal, moderate, and surgical scrub, and it just goes through. I went through all these. And this is the infections again. And then I demonstrated hand hygiene to y'all. So would y'all like to perform hand hygiene back to me? So I can, do y'all have any questions first before we demonstrate?
I do.
What's your question?
Even if you're putting gloves on, like, does it matter if you wash your hands if you're putting gloves on?
You want to be sure that you apply. Most of the time, if you're just going in to do like a routine assessment on your patient, you're going to do the hand foam, rub it together, let it dry, and then apply your gloves. I'm just going to tell you, if you try to apply your gloves onto your hands before they're dry, they're not going to go on. So
I have a question also. Even if you have cut to paint,
it depends if you can.
gloves, I I meant like put the gloves over the.
Yeah, but it depends on how big they are. They can be covered. Like you don't want something that goes out of the line of a glove. Say it's like on your wrist or something, it can't be covered up by a glove. You wanna cover it with a Band-Aid or anything like that. So we're just gonna do this real quick. You're gonna rub them until they're dry. Make sure you get all in your fingers and all that good stuff. While y'all are doing that, we're gonna go over these. We went over the infections were UTI, pneumonia, bed sores, and things like that I mentioned. To prevent the importance of hand hygiene, was that a question?
Yes.
Okay. To prevent the spread of any infections. And then you need the water and soap and the alcohol-based foam and paper towels. So good job. Any questions after this? All right. Thank y'all.